I'm Elizabeth and I'm a volunteer patient advocate for METUP UK. I joined the charity as a volunteer last year, shortly after my secondary diagnosis. In 2010, I was diagnosed with primary breast cancer a couple of years after the birth of my second child. I had 2 children in my 40s, and my breast cancer came soon afterwards, which I understand isn't that uncommon, sort of postpartum primary breast cancer. I had chemotherapy, several lots of surgery, radiotherapy. Then I had a reconstruction of my left breast. And after that, for 10 years, I took tamoxifen, the hormone blocker. And then I thought that was the end of it. However, at the end of 2023, I started getting skeletal problems. I had problems with my shoulders and my arms and my back. I was prescribed anti-inflammatory drugs. I went to the doctor and I was sent for physiotherapy, which seemed to fix it for a while. Then it happened again. And one evening, getting out of the bath, I had the most horrible tearing pain across my ribs. It really felt like my ribs were tearing apart. So I went back to the doctor. I was diagnosed with costochondritis. I was given anti-inflammatories, and I was sent for physiotherapy again. In the meantime, I engaged the services of a private osteopath, who was a lovely lady and kept saying to me, "Are they not sending you for a scan?" This didn't help, although she was a very nice person, and I was sent for more physiotherapy. I went to 2 different classes, and about 2/3 of the way through them, I could barely get down on the mat to move and do the exercises. So they gave me a crutch. And I went back to the doctor and I said, "Can I have an appointment, because I don't think this is getting better?" And they said, "Well, we've not got many appointments at the moment, but we can fit you in if you see a student." And I said, "I'd be delighted to see a student so they can learn about this kind of thing." So I went to see my GP. I saw a student. I saw a delightful young University of Cambridge student, obviously supervised by my own GP. And she said, "You know, you really should have a scan, because you do have a history of breast cancer." I should say at this point, every time I went to the GP, I said I have a history of primary breast cancer. They knew anyway. And the doctor referred me for an MRI. And I said, "I'm claustrophobic." This is my fault. I said, "I'm claustrophobic. I don't want to go for an MRI." So he put me in for a CT scan. And over the next few weeks, there was an exchange between my GP and the specialist radiographer, who obviously knows better than I do, and said, "This lady must have an MRI scan." I eventually went to have an MRI scan at 5 p.m. on Friday, the 27th of September 2024. I went in, had the scan, heard some muttering in the back room, was told to sit down, and I was admitted as a medical emergency because I had imminent spinal cord compression. And I was in hospital for, I don't know, 10 days, I can't remember, which was quite a startling experience, as you can imagine. So between then and now, I've also had a nail put in my thigh because it was at risk of pathological fracture. I'm on my first line of treatment for secondary breast cancer still, on my first line of treatment for secondary breast cancer, which is kinase inhibitors, ribociclib, letrozole, wonder drug, and denosumab, which are bone strengtheners. And I have been stable for the last 18 months. So what I want to say to people is, you don't want to hear this. I don't want to be the ghost of Christmas future. However, breast cancer can come back many years later, especially certain types like estrogen-positive breast cancer. That's not to worry people, because most people who go for primary breast cancer treatment are effectively cured. Statistically, they are. But it can come back. So you really do need to understand the red flag signs and symptoms of secondary breast cancer, because what imminent spinal cord compression actually means is you could have been paralysed. I could have been paralysed. What I'm trying to say to people is, if you've had primary breast cancer, it's likely that you're perfectly well and you'll remain perfectly well. Statistically, it's likely that you will. But for some people, this does come back. Effective early diagnosis and treatment for secondary breast cancer can limit disability, improve quality of life, and indeed extend life. So that's why early diagnosis of secondary breast cancer is still important. You're not a write-off at that point. My story is the subject of a lot of interesting research at the moment into what we call dormancy and late recurrence. So breast cancer, certain types of breast cancer can come back 15, 20 or 30 years later. 15 years later for me, 20 years later for a friend of mine locally. It doesn't happen to everyone, but it happens to a significant number of people. So I really don't want to be the harbinger of bad news or make anybody worry, but it's just a practical thing to know what the symptoms are, so you won't come to the situation I was in, where you were very, very close to permanent disability. And that's why I want to share my story. Anyway, that's me, that's the past, and this is looking forward.